Hey guys, I am studying my camera. I'm also alright. I'm also here to apologize for being the worst YouTube vlogger ever because I was just checking out my channel and it looks like I haven't posted an update for about 4 months. And I think the thing that's been going on there is I record a video and then something gets a bit screwy with the video, and rather than editing it, I just chuck it out and then I think, oh, I just made a video, so I don't need to make another one. And that's probably happened once a month for the past 4 months. So what I wanted to do was do a body update, transition update, and also a personal life update because I know things have been fairly technical, transition-y type updates since my top surgery, and I know I haven't really been too personal with how I've been doing with transition in life. So that being said, what to do first? Um, so I was gonna make a 1 year post-op video, and then and then that thing happened with technology, and then it disappeared into a puff of smoke. So I'm currently 1 year and 2 months post-op, Dr. Garamoni. So I'll start by talking a little bit about that, talking about transition and body changes post-op surgery, which I think is its own sort of thing. So let me just real quick here get this over with. All right. So my chest, 1 year post-op. Maybe the light will be better this way. So this is my chest. Do maybe one of these. Everything is healing really well. I'm excited to have scars that aren't hyper visible this summer. Not that I feel overly self-conscious about them, but it'll just be good to not really be thinking about them at all. From the side, yeah. Okay, so that is essentially what the body looks like. Yeah. And I'm just going to put my shirt back on and I'm going to talk about it a little bit. So, it's interesting. Life post-op is something that I take for granted all the time. I was thinking the other day about how kind of gender confused I was prior to transition. I wasn't sure if being read as a man would be as dysphoric for me as being read as a woman because of my identification as genderqueer. And I think that I was really kind of just overthinking everything a little bit. I know that that's not the case for some people, but for me, since transition, put it this way, I used to feel dysphoric about the female coded parts of my body, and I've never once felt a moment of dysphoria for the parts of my body that are masculine or post-transition now, being read as male or being experienced as male by myself. I kind of think of myself as being in a male embodiment now, and I think that that's awesome, and I'm super comfortable, and I think I feel a sort of I don't know how cis people feel because I've never been cis, but I definitely feel a lack of I kind of take my body for granted more often now in a kind of chill, not really obsessing over it way. I still have a lot of internalized transphobia. Well, a lot. I have a bit of internalized transphobia, a little bit of dysphoria, and that sort of stuff to work through. And I assume that I always will, being a trans person, and being a trans person in a cis-normative world. So, it's one of those things that probably I'll always be struggling with. But it's all totally manageable to me, whereas before it used to feel consistently overwhelming. Now that I have more of an aligned, natural feeling, authentic feeling, embodiment, all of that's a little bit easier. So, reflecting on that, that's just positive changes post-top surgery. Other changes post-top surgery have been almost like a new jump in the continuation of testosterone related changes. So looking back on videos of myself just slightly before and slightly post top surgery, as opposed to like how I experience myself and see myself, and I think I'm seen now. My musculature, I think, has increased. I've gotten a lot broader and thicker, whereas before I was a lot more slender. I had a harder time thickening up, putting on muscle. My pecs, my shoulders, my neck, and everything, I think, have kind of thickened out a little bit, which is interesting because I haven't been doing weightlifting like I was pre-top surgery. But I have been rock climbing and just being generally physically active. Those are the types of things that would never have allowed me to put weight on or muscle on before, and now I can. So that was an interesting, and I think that that's because of the removal of tissue that was, really facilitating a lot of female hormone. So that's an interesting, really interesting change. In addition to that, I feel like maybe my voice has deepened post-top surgery. So that's kind of cool. Negative side of that all is speed up in hair loss. So, feeling really, really self-conscious about the hair loss, which sucks. I understand that it's kind of a, it's a thing that guys have to deal with. 25 years old now, probably, or I will be in a couple of weeks. So it makes sense that I'd be losing my hair, but I don't know. I'm just really feeling quite bummed out about it. Thinking about, well, okay, one thing that needs to happen is I need to have my testosterone levels checked, because I haven't actually done that since top surgery, and it's been about a year, and I feel like if my testosterone levels are a little bit high, then probably my hair loss would be affected by that. So we'll see if I need to alter those at all. And I should do that this week, because I've just kind of been putting it off because I've been strangely anxious about it. So I'll let you guys know kind of how that goes and whether or not I need to lower my dose. And if I lower my dose, I'll keep you guys updated on how I feel about the effects of that. I used to feel really anxious about the idea of lowering my dose. Like, it would increase dysphoria because I really wanted more changes, more muscle, more facial hair, all that stuff, and I wanted it to come in as fast as possible. Now I'm okay with kind of easing off on it a little bit, especially if it means I get to keep my hair, as long as my testosterone levels remain in a male range. And then my backup plan is potentially trying out stuff like Rogaine. I did some research on Propecia, which is a little pill you can take for hair loss that apparently really helps, and there's some weird side effects cropping up all over the place that have to do with guys having suicidal tendencies and thoughts, and breaking up with their wives and long-term partners, and just like going through all manner of hell, and as this sort of noticed side effect that people didn't know about going into it. So that sucks. And also when guys get off the pill, the side effects remain. So I was like, I'm not really willing to risk messing my whole life up for a little bit of hair. But Rogaine is something that I might experiment with. And if I do that, I will document it heavily and let you guys know, because I don't know, I can't really find any resources for other guys who have tried anti-hair loss maneuvers like that. So we'll see. Starting with testosterone levels, going from there. That's really the only thing that I'm struggling with. I am really, since top surgery, a lot of facial hair is coming in. I don't know if I'll ever have a beard. I hope so. I'm still reserving hope. I mean, I'm growing the chops out. I don't know if you guys can see that. And I'm getting more chin hair all the time. I know a lot of guys have changes for facial hair quite drastically right up to 4 or 5 years. So I'm just going to wait and hold off before I make any final guesses as to how that's going to go. Otherwise, in my life, still at the barbershop, still daily trying to navigate being a stealth trans man